In a landmark ruling earlier this year, India's Supreme Court declared menstrual health and hygiene a fundamental right. But in a country like ours, where the mere mention of periods is often considered taboo, or menstruating women are often socially ostracized, misinformation continues to run rampant with respect to menstrual health and hygiene. So to shed more light on the subject and to help separate fact from fiction, I'm joined by a highly distinguished panel of domain experts. And with that, I welcome you to our special televised feature, For Her, With Her. An initiative by Olympic CSR presents Why Menstrual Health and Hygiene Matters in association with FOGSI. Please allow me to introduce our guests. We have with us Dr. Bhaskar Pal, President of Federation of Obstetric and Gynaecological Societies of India, or FOGSI 2026. He's also consultant gynecologist at Apollo Hospital, Kolkata. Dr. Sheila Mane, former Vice President FOGSI and Chairperson of Indian College of Obstetrics and Gynecology. Also consultant obstetrician and gynecologist, Anugraha Nursing Home, Bengaluru. Dr. Manjula Anagani, Secretary, Indian Association of Gynecology and Endoscopy, Telangana, Clinical Director and HOD of Obstetrics and Gynecology Care Hospitals, Hyderabad. Dr. Basab Mukherjee, former Vice President, Federation of Obstetric and Gynaecological Societies of India, or FOGSI, and former President, Bengal Obstetric and Gynaecological Society. Also Director at Anuvaran Pluro Fertility and Fetal Medicine Center. And Dr. Rohan Palshetkar, Chairperson, Federation of Obstetric and Gynaecological Societies of India, FOGSI, Young Talent Promotion Committee, and Honorary Secretary, Association of Maharashtra Obstetric and Gynaecological Societies, and practicing obstetrician and gynecologist, Mumbai. Dr. Bhaskar, if I could kick off the conversation with you. You know, a very troubling statistic and study seems to indicate that nearly 50% at most of young girls are aware of the concept of menstruation before the onset of their first menstrual period. All right? And unfortunately, and particularly in this country, menstruation still seems to be associated with shame, with cultural taboo, and deep-rooted stigma. To what extent have we made progress as a nation in that regard? And are we beginning to witness meaningful change?
I think it is still a problem. I think we've made progress, but the progress has essentially been in urban areas, in societies where mothers educate the girls, in schools where there are programs where the girls are educated. But especially when you go to rural and semi-urban areas, majority of the girls are taken by surprise when they have their first menstruation. Sure. It is not only a question of stigma, which is there, but it is also a question of fear and shock. And they are prepared only after this has happened. Right. So there is a lot of gap that needs to be breached, especially in the rural and semi-urban areas, where we prepare girls what the menstruation is, so that they don't go through this fear, shock and shame when it suddenly happens.
And on that note, if I could come to you, Dr. Basab, because I'd like your understanding of what you believe are the leading myths and misconceptions surrounding menstruation.
There are several myths and misconceptions that we keep on hearing about menstruation in our clinical practice. So where women are told not to have any exercise or physical activity during menstrual cycle, which is absolutely unfounded. They also are told to have some dietary restrictions, which is unfounded. The other myths would be around the amount of bleeding, where people are concerned about scanty periods, people are concerned about irregular, if it's just a slightly irregular, but there is a range between 21 days and 35 days where women can be normal still with regular periods. Yeah. Then the pain is often underestimated. Some people take pain as normal, but it could be hiding some of the gynecological diseases which needs to be addressed. Then the other myths would be around white discharge, which is something quite normal and physiological in most cases. But there are some times when it could be a part of a disease where it needs to be addressed separately, and that is times when women would need to approach it. But generally they consider white discharge as some proteins and vitamins leaving the body, causing weakness and fatigue, and those are quite unfounded.
Can I just add two more myths, especially in our side of the city and all. It is first thing it is said it's a bad blood which comes out, impure blood. That is a myth which goes around. And they're supposed to sit outside the house. They cannot enter into the house, and they're not supposed to touch the pickles because they think that if they touch the pickles and all, they'll all be spoiled. So all these myths have been going from ages, and we have to debunk them.
Right.
From the year 2006, FOGSI, which is a federation of different societies, through their societies, have gone into schools to do programs on essentially on preparing women girls about menstruation. And we started this from the class 7, class 8, class 9, class 10. We had a different module for them. Unfortunately, because it is run through schools, that is the only way we could get to the urban girls and semi-urban girls. Right. The bigger challenge is how we can get into the community, especially what the government can do, so that in the schools which are funded by the government in extreme rural areas, unless we bridge that gap, we're not going to overcome this.
No, you're absolutely right, because the urban-rural divide in this country is very real. And you were mentioning,
I would
Dr.
like
Mani.
to that. So that urban-rural divide, as Supreme Court, Honorable Justice Pardiwala and Mahadevan had given that under the Section 21, that it is her right. It is not only hygiene. Okay, when we talk for her and with her, it is not only hygiene, it is menstrual health. And the Supreme Court has told the government, and the government has given directions to the states and the UTI. And there are different schemes have come under government, particularly for the rural girls. That is menstrual hygiene management. That means see to it that sanitation facilities are available. That is toilets, water, and the sanitary products.
Gender segregated toilets.
Yes, and even the disposal. And then comes the availability of sanitary napkins at ₹1 in Pradhan Mantri Jana Aushadhalaya. Okay, and the Ashas are given a packet of sanitary napkins which cost only ₹6, which she has to distribute, and it was given multiple states. It has been going on. And then next, we have adolescent health clinics, that is Rashtriya Kumari Kendriya. So there this awareness is given to them. And then comes the Swachh Bharat Abhiyan, where we will have to look at the environment. So the disposal is also equally important, and awareness through Ashas. So if we want to bring awareness, it is not only schools, the society, the parents, and the students. Yes, it starts there. We catch them early.
It requires an ecosystem.
Yeah.
Nobody can do it in isolation. Yeah. I want to come back to you for a moment, Dr. Manjula. And regardless of levels of awareness, I think the fact of the matter is that these conversations are not easy. All right, when a girl first gets introduced to the concept of menstruation, it's an incredibly sensitive conversation. So at what age or stage of their life cycle does the conversation need to take place, and who's in the most appropriate position to do so in your view?
So we look at 8 to 10 years as the age which is the right age for us to make them aware. So it has to be started with what she has to expect should be the first way of telling them. Then she start becoming mature of understanding how her height is going to be, how her physique is going to change. Then comes the actual thing, how to maintain what is going to happen, in the sense menstrual hygiene, what happens when the menstrual blood comes down. Then comes that this whole thing is about her future reproductive health. That empowers her to know that she'll be changing, transforming from the shame to understanding it's a norm and it is something which is her right. The first person to tell should always be somebody whom she's emotionally connected with and whom she's comfortable with. That will be naturally mother. Second, in a scientific way, the schools will tell us, like this is how the menstruation happens and kya ho raha hai. The third thing jo hard facts and credibility jo dete hai, wo hai doctors.
Do you believe that not just young girls, but young boys also need to be a part of those conversations?
In fact, that was something that I was going to bring up right now, that we keep talking about educating the girl, educating the woman. Right. A boy who's in the household is going to be irrespective around his mother, his sisters, aunts, grandmothers, etc. They're going to go through a variety of physiological changes through the entire livelihood. So the entire conversation about menstruation, about periods needs to be made very normal within the household. When it comes to who should be the person discussing? That you have to, I always say that there needs to be a safe circle around the child. So it could be like now in my household, I've got my mother who's a gynecologist, I'm a gynecologist. But I think at the end of the day, she may be most comfortable with her mother. But then she can always know that if her mother isn't there, we are always around if she has any questions to ask. So it's not just about the girl, because a boy also needs to understand that there's no taboo or there's no shame around this. Even if you just keep the periods, talk about the periods, keep the sanitary napkins in and around, in an accessible, in a visible area, there might be just some fruitful questions that come. Sometimes they ask us very pinpoint questions which may become an awkward situation for us, but a simple thing is just to ask them, what do you mean by it? What do you have an understanding, to understand their perspective where it comes from? So simpler questions to be answered in a simple scientific manner, or even in a more casual manner in a conversation, will help break that taboo around this entire situation, and in addition to that, just make the entire conversation comfortable.
Well, Dr. Sheila, say all awareness efforts aside, a young girl knowingly or unknowingly simply neglects her menstrual health and hygiene. What are the potential consequences she's looking at across all stages of life, really, from puberty to perimenopause?
See, when we say menstrual hygiene, the WHO defines it as menstrual health, which covers physical, psychological, as well as the social issues when it comes to menstrual health. And now the neglect can happen due to stigma, lack of awareness, and access issues. So if we take her journey through puberty till menopause, at puberty we know that they have irregular cycles and some girls really bleed, and it has been taken as a normal thing by the parents or by the family that can lead to anemia. So most of the time we find them anemic. Then the period pain, I think Dr. Bhaskar already mentioned about that, which is again, if it is too much, it is neglected, and that could be a condition which has she has already, like a endometriosis. Sure. And if the hygiene is not maintained, it can lead to infections, reproductive tract infections, urinary infections, which can affect her in future life. So when we come to adulthood, like she is in a reproductive health life, yes, the same infection, if not taken care, can continue. She can have reproductive tract infection, which can affect her fertility in future, can lead to pelvic inflammatory diseases, again a menstrual abnormalities, and now we see a lot of hormonal imbalances. That is the lifestyle and the diet. And then where the commonest condition they face is now PCOS, where they put on weight, they have irregular periods, and if they are overweight, again the body shaming, they feel they are different than others. These issues need to be addressed at that stage. So over a period of time, I think it is always a transition for a girl from adolescence till menopause and even postmenopausal. So we have to start from here and tell them that whenever you feel that it is really not keeping you healthy and it is affecting your physical as well as the mental well-being, it is always better to consult a physician.
It may appear simple, but it's the subject of lots of debate. So how often does, let's just say a sanitary napkin or a tampon or a menstrual cup need to be changed? What constitutes proper menstrual hygiene? I think there's no single answer here, but would appreciate your guidance. And secondly, given the sheer range of products available on the market, how does one determine what's right for them?
See, I think like you said, it's the most debatable question but the basic underlining thing is you should be changing it before it becomes completely full or completely wet. So it has to be depending on the amount of flow you have, the type of the lifestyle you undergo. So usually a sanitary napkin should be changed every 4 to 6 hours, or even the menstrual cup when you go, it is again 4 to 6 hours, or 6 to 12 hours sometimes with the menstrual cup if a flow is low. If it is a tampon, again 4 to 6 hours. So on an average, it should never cross 8 hours. That is what we look at. But if its flow is less and your menstrual cup is there, and if your facilities are not there. So here we are talking about 4 things which are important. One, what is that amount of flow you have? Second, how are you comfortable with your own body? So that depends on, if you're early beginners, they would prefer a sanitary napkin or a period panty over a menstrual cup or a tampon, right? So once you're comfortable with your body and you're okay with something inside your body, then the menstrual cup and tampon will come into place. And the third is your lifestyle. If you're a model, if you're a movie star, you would prefer something which is not seen and does not look bulky and everything. And you have to travel a lot and everything. You want something for a longer time, you would go with menstrual cup or something like that. And the fourth would be, what are the facilities available along with you? If there is something like water and everything available to wash, then menstrual cup, because you need to wash it every 6 to 12 hours. And if it is not available, you just have something to dispose, then sanitary pads make this thing. So everything depends on you and what you do and how you go about with it.
Dr. Sheila, I want to come back to you then. Basis what we've just heard from Dr. Manjula, I'm not sure if it's medically endorsed, but the cloth, the reusable, washable cloth that we continue to see so many women in rural areas depend on. Is that medically advisable, number one? And number two, we touched on this a moment ago, but I want to do a deeper dive on the potential consequences of poor menstrual health and hygiene and how that impacts a woman's ability to conceive naturally and have a healthy, normal delivery down the road.
As you mentioned about the cloth, most of the time they cannot dry it in a sun. Right. So it remains wet and it is reused. So that has to be given up. We have to teach them that hygienic products need to be used. Because, and as Dr. Manjula mentioned, that if they don't change it frequently, if it gets soaked, it's a blood, the infection can happen. It can they can have a vaginal infection which can ascend up to the genital tract and which can lead to the infection of the uterus, of the fallopian tubes. And that infection during pregnancy can affect the pregnancy, which can lead to abortion, which can lead to premature labor, and even infections during labor, which can affect her pregnancy, as well as even after pregnancy they can have infections. So menstrual hygiene and menstrual health for her is very important issue.
And coming to you now, Dr. Rohan, we've heard about some of the consequences, all right, and as daunting as they are, I think it's important to also have a conversation around some of the preventative measures that can be enabled, right? Beyond what we've heard, what else comes to mind?
The visit to the gynecologist is extremely important. If you have any signs or any symptoms of these infections, such as the itching and the foul smelling discharge, it's important that you visit the gynecologist, be aware of these symptoms, because that's the first sign that's going to actually indicate that you go over there.
I want to switch gears for a moment, coming to you now, Dr. Bhaskar. All right. Unfortunately, polycystic ovarian diseases in this country run rampant now. But I think it's often misunderstood phenomenon. So I'd like your understanding of how closely intertwined menstrual cycles, weight management, and polycystic ovary disorders actually are.
At the present moment, too much of junk food, too little exercise, too much of studying, and that is all contributing to this. Sure. Now, what polycystic ovaries manifests as, it usually will manifest as irregular periods. While most women will get delayed and scanty periods, some will get more frequent periods. Sometimes when the period is delayed, the period can happen for a longer period of time and women can lose blood. This is one way of presentation, and the second way of presentation is getting abnormal hairs and acne. While acne, menstrual acne may be normal, doesn't necessarily related to polycystic ovarian syndrome. This actually can be a manifestation of polycystic ovarian syndrome. If you are obese, then of course weight reduction will, in most of the situations, bring it back to normal. I think there are two aspects. One is menstrual hygiene, and when we talk of menstrual health, when we say for her, with her, then what is important is people know what is normal and what is abnormal. Absolutely. Now, in medicine and in health, the most important risk factor is your genetics. Now, if You are the mother and you're telling your daughter what is normal and abnormal, you're going by your experience. Right. So a mother who's always suffered from period pains will tell her daughter, don't worry, this is normal. A mother who's had more frequent periods will tell the daughter, don't worry. Yes. So I think it is important, that's what we see regularly. Yes. We see normalization of abnormal symptoms because people around the girl, her mother or aunt or grandmother said, or even general practitioners said, don't worry, this happens. Sure. Commonest issue is menstrual pain. The girl is in so much pain, she can't go to school or college and says, don't worry, once you get married, this will get better. No, it's wrong. If you have such pain or you have such bleeding that you can't do your normal household work or you can't go to school or college, you need to go and see a doctor.
I want to come to you, Dr. Basap, with my next question, because we constantly hear of irregular periods or heavy bleeding or excessive uterine bleeding. Let's put some measurements to this, some parameters such that it can actually be declared irregular, heavy or excessive. What makes it so?
Heavy menstrual bleeding would generally be constituted as bleeding for lasting more than 7 days, where you have to change your pad as frequently as every 2 hours in some cases or some of the days, where you're passing large clots, where clots would constitute a large amount of blood which would be leaving the body. Then the woman would have signs and symptoms of anemia or low hemoglobin, which would generally be tiredness, easy fatigability, problem in sleeping, decreased appetite. And if you want a lab test with that, a low hemoglobin would sum it all. The consequences of heavy bleeding, the anemia, which needs to be corrected with some sort of a iron therapy, medication usually, and that would make logical sense about doing that. For irregular periods, as we already mentioned, if it is less than 21 days or more than 35 days, and it's persistent, not an isolated one time. It should be month after month or year after year, and sometimes you may have periods, time when there is no periods for a few months. So that needs evaluation. Along with that, if there are features of polycystic ovary, as we mentioned, weight gain or sudden weight loss, along with acne, facial hair which you don't want, and losing scalp hair which you also don't want, and along with that if there is a nipple discharge, all those things could constitute hormonal changes which need addressing, which needs evaluating, and needs some sort of a supervision by a medical professional.
One question that's on the minds of many girls is, what are the right foods to eat such that my menstrual cycle can become normal? Does exercise in fact help regulate my menstrual cycle, or is it largely folklore? How do you address those questions?
More than 50-60% of our women are anemic, and it should start from there. So again, a GOI have an initiative of 12 pe 12. That is at the age of 12, her hemoglobin should be 12. I think that message has to go to community. And your next question was regarding the lifestyle. See, your ideal weight is your height in centimeters minus 100, and we used to tell them 100 skips a day keeps 100 gram fat away. Nowadays children don't like to eat vegetables. They definitely like the junk food. We can't say that there is big no. Yes, once a week they go out, they are going to eat chocolates, they are going to eat pastries and burger and everything. Sure. But the daily, it starts at home only. Right. What we feed them, sure, that makes their body. Right. So why they are putting on weight? Because they are not eating well. So that is one thing, and then comes the exercise. Now exercise is must. Now it is not that, we have to involve them in the household chores. Like they are sitting in front of the TV and eating, and the mother is, today's mothers try to be a superwoman or a super mother. They don't have to be. I think we should involve them in household activities so that they are active and there. And of course, the play, we should see to it that at least they are involved in some activities, like playing games, which is not happening, but we have to come back to that.
Very briefly, your take on whether social media has been a blessing or a curse in the context of menstrual health and hygiene awareness.
Social media has been a bit of both, because now I see a lot of doctors coming onto the platform, giving the right information at the right time in innovative ways as well, the way the audience wants to actually consume it. However, the thing is, I think we started maybe 5 years or 10 years a little too late to come onto this platform, where now, as you asked us, can you debunk myths? That's what we're having to end up doing on social media, because there are a lot of misinformation out there which becomes a bane where social media is concerned.
In January of this year, the Supreme Court of India issued a landmark ruling in which they directed authorities, be it governments, schools, colleges, to make sanitary napkins available free of cost and to gender segregate washrooms. Right. All right. The ruling in and of itself is a milestone ruling, as I mentioned. By leveraging this platform, share their personal message that they'd like amplified to stakeholders that may be watching from the public sector.
So essentially, yes, girls need toilets in their school which are gender segregated with running water. They need access to cheap or free menstrual hygiene products. But at the same time, we need to raise the level of awareness in the school and in the society and home. Only then we will succeed in taking this entire endeavor forward.
And coming to you for the final word, Dr. Basav, the reality is that 23 million girls drop out of school in this country every year, all right, because of lack of access to proper menstrual hygiene and health products, facilities, and the list goes on.
Yeah, so all of us as medical care professionals would welcome the Supreme Court ruling, but the elephant in the room, as Dr. Sheila said, is implementation. So only after it comes into action, it makes a difference on the ground. When it comes into action, will we be seeing more change, which we want to see for her, with her.
Well, Dr. Basav, Dr. Sheila, Dr. Bhaskar, Dr. Manjula, and Dr. Rohan, it's been such a pleasure to share this space with you, and thank you for shedding light on this incredibly critical cause. We wish you and your teams all the continued success, and we salute everything that you do. Thank you so much.
Thank you.
Thank you.
It's been a pleasure.
And with that, our special feature, For Her, With Her, an initiative by Olympic CSR, presents Why Menstrual Health and Hygiene Matters in association with FOGSI, comes to a close. Thank you to our distinguished panel of doctors for humanizing the conversation. We trust you found the insight shared of value. Thanks for watching.